everyone, welcome to TryRide. This is Pack 365, myself Srija. So today in this session, you are going to learn about the ICD-10-CM coding classification for the diseases of eye and adnexa. So how the ICD-10-CM codes has been classified for the disease under the eye. So this chapter, it organizes all the disorders related to the eye in a systemic way so that the diagnosis is coded correctly. So insurance companies can reimburse correctly, statistics about eye diseases can be collected, and clinical communication remains clear. So how the codes are arranged in chapter 7 under H00 to H59 series. So what is the structure of these codes? So H plus 2 digits, that is 00 to 59. It's a broad category plus 1 or 2 additional digits. It's a clinical details such as laterality, severity, type of disease and the stage. So there are some of the examples like H00 which you assign the code for style and H01 which you assign the code for eyelid dermatitis. So these codes, this ICD-10-CM classification of diseases, they organize all the disorders related to the visual system. So this chapter, it includes about the conditions which are affecting about the eyelids, orbit, conjunctiva, sclera, cornea, iris, lens, choroid, retina, and each and every part of the eyeball. So what is the importance of this classification for healthcare professionals? So this classification, it helps to describe the disease precisely. It makes the documentation clear and complete. It ensures the accurate billing. It supports the epidemiological studies and it also improves the continuity of the patient care. So coming to the classification of eye diseases. So H00 to H05. This category it includes the disorders of eyelid, lacrimal system and orbit. H10 to H11, disorders of conjunctiva. H15 to H22, disorders of sclera, cornea, iris and ciliary body. H25 to H28, it includes disorders of the lens. H30 to H36, it includes the disorders of choroid and retina. H40 to H42, it includes the glaucoma. H43 to H44, it involves the disorders of the vitreous body and the globe. Whereas H46 to H47, disorders of optic nerve and visual pathways. 49 to 52, disorders of the ocular muscles, binocular movement, accommodation and the refraction. H52 3, H54, visual disturbances and the blindness. H55 to H57, they include other disorders of the eye and adnexa. And the last category H59, it includes the intraoperative and post-procedural complications as well as the disorders of eye and adnexa not elsewhere classified. So let's have the overview of each and every category under these eye diseases. So coming to H00 to H05 category. So this ICD-10-CM codes H00 to H05, they include the diseases affecting the eyelids, meibomian glands, lacrimal system and also the orbit. So these conditions are usually the infections like hordeolum, inflammatory conditions like blepharitis, obstructive gland diseases like chalazion and the structural abnormalities of the eyelid. So the code also includes the laterality, whether it is a right eye, left eye or upper and lower eyelid. So H00 coming to code H00, it is assigned for hordeolum and chalazion. So what do you mean by hordeolum? It's an acute bacterial infection of the meibomian gland, which is the internal hordeolum, and also the gland of Zeiss or hair follicle, which is the external hordeolum. So what are the characteristics of the hordeolum? Painful and tender swelling, sudden onset, redness and warmth. This is usually caused by the Staphylococcus aureus. So what are the examples given over here? H00.011 for external hordeolum right upper eyelid, whereas H00 to 015, it is assigned for external hordeolum left lower eyelid. So these codes show ICD-10 precision by including the type of hordeolum, whether it is an external or internal, and the side right and left, whereas the eyelid position upper or lower. So what is the example? External style on the right eyelid. So which code you will assign? H00.011. So next is Salazian. H00.1 code is assigned for the Salazian. So Chalazian, it is a chronic inflammatory blockage of the meibomian gland, which is leading to a firm painless limb, slump, or slow development, often follows an untreated hordeolum. So this chalazion, it is not caused by the infection but by the gland obstruction. So for example, when it is given as chalazion on the left eye, so what you have to code? H00.12 code. So next is H01, which includes other inflammation of the eyelid. So this group, they includes blepharitis, dermatitis of the eyelid, and also the non-infectious eyelid inflammation. So what do you mean by blepharitis? It's a chronic inflammation of the eyelid margins. So this is often due to bacteria, allergies, or the seborrheic dermatitis. So what are the symptoms? Itching, crusting, foreign body sensation. For example, H01.0 code is given for blepharitis. So in the right side, you can see the pictures of external hordeolum and internal hordeolum. External hordeolum, it occurs at the lid margin. You can clearly see in the picture. It occurs at the lid margin. It involves the lash follicles, and also this is visible as small red ball-like swelling. Whereas internal hordeolum, it is a deeper infection inside the lid. You can clearly see, right? It is inside the lid. So this is more painful, and this also involves the meibomian glands. So what are the symptoms shown in this slide? Watery eyes, discharge, light sensitivity, feeling of the foreign body, swelling and redness. So why ICD codes are detailed like upper, lower, right or left? Because the eye has a precise anatomy, and treatment, documentation and reimbursement, they depend upon only the accuracy. So for example, the right upper eyelid versus left lower eyelid makes a diagnostic difference. So coding errors, they affect the insurance claims and also the medical records. So this is the chalazion you can find over here, and this is the hordeolum and the flakes at the base of the eyelashes. So chalazion, it looks like a cyst, right? Slightly pink in color. And hordeolum, it is at the beginning of the margin of the lid. So next, coming to H01.1 code. It is given for non-infectious dermatitis of the eyelid. So this category includes the inflammation of the eyelid skin, which is not caused by the infection. So examples include allergic contact dermatitis, atopic dermatitis, seborrheic dermatitis. So what is the example? Allergic blepharitis of the left eye. So whenever documentation gives you this allergic blepharitis left eye, then you have to assign the code H01.002. Where H01, it indicates other inflammation of the eyelid, 0 for blepharitis, 02 for left eye. So here you can see the clinical features from the image. Crusted eyelashes, skin appears greasy, the greasy appearance of the eyelid skin, swollen eyelids, redness and irritation, and also itching or burning. So these are all the symptoms of blepharitis infection. So next, coming to H02 code. This describes about other disorders of the eyelid. So this group includes the structural and mechanical abnormalities of the eyelids. They list ectropion, entropion, ptosis, lagophthalmos, and also trichiasis. So H02.0 is given for entropion. So what do you mean by entropion? The eyelid turns inward. It causes the eyelashes to rub against the eye. So this condition is called as entropion. So what are the clinical features of entropion? Irritation, corneal abrasion risk, watering, and also foreign body sensation. So H02.1 is ectropion. Ectropion is nothing but the eyelid turns outward, exposing the inner lid. So you can clearly see the picture, entropion eye, entropion over here. In entropion, the upper or lower eyelid, they turn inward, causing the skin and eyelashes to rub against the eye. Whereas in ectropion, it is when the lower eyelid sags. You can clearly see in the picture, the lower eyelid it gets sagged and it turns out, resulting in the exposure of the eyeball. So this is about the difference between entropion and ectropion. So next, coming to ptosis. Ptosis refers to the drooping of the upper eyelid due to the congenital abnormality, muscle weakness and also the nerve damage. So whenever congenital ptosis right eye is diagnosed, you have to assign code H02.401. Whereas in this code H02, it denotes for ptosis, 0 for unspecified type and 1 for right eye. So what are the clinical features of the ptosis? Drooping eyelid, reduced visual field, compensatory chin lift in severe cases, and this is also very common in the children. In the right side, you can clearly see the picture. This is the ptosis. So here the upper eyelid is completely drooped. So next, coming to H04 category code. H04, it describes about the disorders of the lacrimal system. So the lacrimal apparatus, they includes the lacrimal gland which produces the tears and lacrimal sac and duct which drains the tears. So disorders may cause the dryness, infections or tear drainage problems. So how are clothes classified in H04 category? H04.0 for dacroadenitis. So what do you mean by dacroadenitis? It's an inflammation of the lacrimal gland. So what is the symptom? You can experience the painful swelling in the upper outer eyelid. You can see the redness and also tearing. So why this is caused? It is mainly caused by the bacterial infection, viral infection like mumps and Ebola, and also through autoimmune disorder like Sjogren's syndrome. So H04.1 is for epiphora. So epiphora is nothing but excess tearing. So tears overflowing onto the cheek. So what are the causes of the epiphora? Obstruction of the nasolacrimal duct, dry eye reflex tearing, entropion or ectropion, and also the conjunctivitis. So H04.5 is assigned for stenosis of the lacrimal duct. So what do you mean by stenosis? Narrowing or blockage of the duct that drain the tears. So for example, there is a blocked nasolacrimal duct of the left eye. So what you have to assign? H04.55 to code. So what are the clinical features of the stenosis of the lacrimal duct? Watering of the eyes, recurrent infections, purulent discharge, and also crusting of the eyelids. So this stenosis is most commonly seen in infants and in the older adults. So next, coming to category H05. H05, it describes about the disorders of orbit. So orbit is the bony cavity that contains the eyeball, extraocular muscles, fat, nerves, and as well as the blood vessels. So disorders here are often more severe because they can affect the vision quickly. So H05.0 code is assigned for acute inflammation, nothing but orbital cellulitis. So what do you mean by orbital cellulitis? It's a serious bacterial infection of the tissues around and behind the eye. So there are many tissues, right? There are many tissues present around and behind the eye. So the bacterial infection occurs at these tissues, resulting in the orbital cellulitis. So what are the clinical features? Painful swollen eyelids, redness, fever, restricted eye movements, and bulging of the eye. So example is orbital cellulitis right. H05.011 code is assigned for orbital cellulitis right. So next, coming to H05.2, exophthalmos. So exophthalmos, it nothing but also called as the propoptis. So it's an abnormal forward bulging of the eye. You can see in this picture, this is a normal eye. This is a proptosis eye. So this is an abnormal forward bulging of the eye. The common causes are the thyroid eye diseases, orbital tumors, and also the inflammation. So what are the symptoms of the exophthalmos? Eye protrusion, dry eye due to exposure, double vision, and eyelid retraction. So this shows you a comparison of normal and proptosis. So next is H05.3 code for orbital deformities. So structural abnormalities of the orbit such as congenital deformities, trauma related, maybe a post-surgical orbital changes. So these are used whenever the changes alter the shape or function of the orbit. So this is about H00 to H05 category code description. So next coming to category codes H10 to H13, which includes the diseases affecting the front surface structures of the eye, nothing but the conjunctiva, sclera, cornea and iris. So H10 code is assigned for conjunctivitis. So what is conjunctivitis? It's an inflammation of the lining of the thin membrane inside of the eyelid, surface of the sclera, and conjunctivitis is nothing but it's an inflammation of the membrane. So H10.0, it is mucopurulent conjunctivitis. So what do you mean by mucopurulent? Mucopurulent means it's a thick pus-like discharge which is usually a bacterial discharge. So what are the symptoms of this mucopurulent conjunctivitis? Redness, yellow or green discharge, crusting of eyelashes, sticky eyelids, and also the mild pain or irritation. So for example, whenever H10.023 code should be assigned, it must be the description like acute bacterial conjunctivitis. So there are other types of conjunctivitis like viral, allergic, and also chemical. So next coming to H11 category, other disorders of the conjunctiva. So this group, they includes the pterygium, subconjunctival hemorrhage, conjunctival cyst, and also the conjunctival scarring. So H11.0 is for pterygium. So what do you mean by pterygium? It's a benign fibrovascular growth which is extending from the conjunctiva onto the cornea. So this pterygium, it is common in people who are exposed to sunlight like UV radiation and dusty environments and also the wind exposure. So what are the symptoms of pterygium? Redness, irritation, and also this may affect vision if there is large. So whenever a patient is diagnosed with pterygium, you have to assign the code H11.0. So next is H11.3, subconjunctival hemorrhage. So this is nothing but it's a small bleeding under the conjunctiva. So what are the causes of the subconjunctival hemorrhage? Sneezing, coughing, trauma, hypertension, and also the blood thinners. So what are the symptoms? Bright red patch on the eye, usually painless, harmless, and it resolves on its own. So subconjunctival bleed right eye is given for the code H11.31. So the right side you can clearly see the picture, exophthalmos and about the conjunctivitis. So exophthalmos, one label is normal, other label is proptosis. I already said you proptosis means it's a forward bulging or protrusion of the eyeball. So when the eye protrudes beyond the normal line, which is marked by the dotted line in this diagram, it is called as the proptosis. So why it happens? Because of the inflammation, thyroid eye disease, tumors or infections behind the eye, and also the trauma. So the normal eye sits within the socket and the proptic eye, it moves forward crossing the dotted line indicating the abnormal protrusion. So next picture is about the conjunctivitis, is also called as the pink eye. So it explains the normal eye structures and how the conjunctivitis appears. So conjunctiva, you can clearly see here, it's a thin membrane covering the sclera and inner eyelid, and sclera, it is a white part of the eye and eyelid. So this is the difference, this is the comparison between normal eye and conjunctivitis eye. So in the normal eye, you can see there is no redness, no discharge, there is a clear cornea and there is no even the swelling. Whereas in conjunctivitis eye, you can see the redness and swelling, discharge, crusting and also the follicles on the inner part of the eyelid. You can see the small bumps. It is common in the viral conjunctivitis. They appear on the inner eyelid surface, especially seen in the morning. So this is about the picture of the conjunctivitis and the comparison between the normal eye and the conjunctivitis eye. So next category is H15, which describes about the disorders of sclera. So what is the subcode? H15.0 scleritis. So what do you mean by scleritis? It's a painful inflammation of the sclera. Sclera is nothing but it's a white outer coat of the eye. Right. So here you can see the picture of the scleritis. So this image shows a severe redness within the sclera region. You can also see the dilated blood vessels, and sometimes this is bluish due to the thinning. So scleritis is usually deep, painful, and also the severe. So next is H15.1, which is assigned for episcleritis. So it's a milder inflammation of the thin layer over the sclera. So some symptoms include the localized redness, mild discomfort, and also the less painful compared to scleritis. For example, if the patient is diagnosed with the episcleritis right eye, you have to assign the code H15.0 level. So next is H16 keratitis, which is a corneal inflammation. So these codes describe the diseases affecting the cornea. So H16.0 code is given for corneal ulcer. Nothing but the loss of surface layer of the cornea. This is usually painful with tearing and light sensitivity. Whereas H16.2 for keratoconjunctivitis. So this inflammation involves both the parts of the eye over here. They involve both the cornea and also the conjunctiva. So one type is keratoconjunctivitis sicca, which is called as KCS, commonly known as dry eyes. So in this diagram, you can clearly see the healthy eye and the dry eye. So healthy eye, it shows a smooth, moist cornea, whereas in the dry eye, the cornea shows the dry ocular surface, inflamed conjunctiva, and also you can see the reduced tear fillet. So next is H16.3 code for interstitial keratitis. So this is the inflammation within the middle layer of the cornea, nothing but the stroma. So this can cause the corneal haze, vision reduction, and the example is viral keratitis left eye. You have to assign the code H16.152. H17 for corneal scars and opacities. So H17.1 is assigned for the adherent glaucoma. Adherent glaucoma is a dense white scar on the cornea. It usually forms after a severe ulcer or trauma. So this can stick to the iris, which is adherent. You can clearly see this picture. This is the cloudy white gray cornea. You can see the scar over here. This indicates the permanent scarring. So this reduces the vision. For example, corneal scar after the healed ulcer, you have to assign the code H17.11. So next coming to H18 for other corneal disorders. So this explains the two major regions of the ICD-10 eye diseases. One for H18, the other corneal disorders, and H22, it's a disorders of iris or ciliary body. So H18, this category includes keratoconus, corneal edema, and corneal dystrophy. So what do you mean by keratoconus here? Keratoconus is nothing but it is a condition when the cornea becomes thin and bulges outwards like a cone. You can clearly see in this picture over here. It is bulged, right? It is bulged and it resembles the cone structure. So this changes the cornea shape, causing the distorted vision, blurring, and light sensitivity. So the normal cornea, it is a smooth, rounded, and evenly curved, whereas keratoconus cornea, it protrudes the forward, which is a cone shape due to the thinning. So you have to assign code H18.601 for keratoconus right eye. So then for H22 category code for which describes the disorders affect the colored part of the eye called as iris and the ciliary body, which helps to focus the lens. So H20 code is assigned for iridocyclitis. So what do you mean by iridocyclitis? Inflammation of both the iris and ciliary body. So this is a type of anterior cyclitis. So it is also called as uveitis. So H20.0 code for acute iridocyclitis. Nothing but acute is nothing but short-term inflammation. So what are the symptoms of the short-term inflammation? Red eye, photophobia, pain, and also the blurred vision. Whereas chronic iridocyclitis results in the long-term inflammation, like long-standing and recurring inflammation. So in the example, you can clearly see this. The normal eye, there are clear structures and there is no redness. Whereas the inflamed eye, you can see the redness around the iris and pain and tearing and also sensitivity to the light. So you can see this inflamed iris area in the diagram clearly, which is the inflammation of the front part of the eye. So next is H21.0 code assigned for hyphema. So what do you mean by hyphema? It's a blood in the anterior chamber, the space between the cornea and iris. So this is usually caused by trauma, surgery, and the blood vessel rupture. And here you can see the diagram of the hyphema. This is a normal eye. This is a hyphema affected eye. In normal eye, the front chamber is very clear. Whereas in hyphema, the blood collects in the front of the iris, which is seen as a reddish fluid level. Right? You can see the red color over in the iris. So the blood collects in the front part of the eye. For example, traumatic hyphema, right eye, you have to assign the code H21.0. So this is for today's session. I hope this session has helped you. So in the next session, you will be learning about the code classification from H25 to H59 series. Thank you.